Have you ever wondered why your baby seems to be fussier than usual or pulls at their ears more frequently? Ear infections are a common issue among infants and can be a source of great concern for parents. Today, we'll explore everything you need to know about managing and preventing baby ear infections. Ear infections are common in babies and young children, causing pain and discomfort. The middle ear is connected to the back of the throat by the eustachian tube, which is shorter and more horizontal in babies. This makes it easier for bacteria and viruses to travel from the throat to the middle ear. Babies also have a developing immune system, making them more susceptible to infections. When a baby gets a cold, the virus or bacteria can easily spread to the middle ear. The most common type is acute otitis media, AOM, where parts of the middle ear get infected and swollen. Another type is otitis media with effusion, OME, where fluid remains in the middle ear even after the infection is gone. This can affect your baby's hearing. Acute otitis media is the most common type of ear infection in babies. It happens when the middle ear gets inflamed and infected, usually caused by bacteria or viruses. The eustachian tube in babies is shorter and more horizontal, making it easier for germs to travel from the nose and throat to the middle ear. Symptoms of AOM include ear pain, fever, irritability, fussiness, difficulty sleeping, and loss of appetite. Recognizing these signs early on is important for prompt treatment and relief. In some cases, fluid may drain from the affected ear. Otitis media, with effusion, OME, occurs when fluid builds up in the middle ear without any signs of infection. This fluid is usually sterile and often develops after an episode of AOM. Allergies, colds, and exposure to secondhand smoke can also contribute to OME. Babies with OME may not have fever, ear pain, or drainage, but the fluid buildup can temporarily affect hearing. Persistent fluid in the middle ear can impact a baby's hearing and speech development. If left untreated, OME can lead to more serious complications, such as chronic ear infections and hearing loss. Chronic otitis media with effusion, COM, is a persistent form of OME, where fluid remains trapped in the middle ear for an extended period. This condition can significantly impact a baby's hearing and overall development. COM is more common in children with recurrent ear infections, allergies, or certain anatomical factors. The prolonged presence of fluid can lead to recurrent ear infections and potential hearing loss. Early detection and treatment of COM are crucial to prevent long-term complications. Interventions may include hearing aids, speech therapy, and surgical procedures to improve drainage. Recognizing ear infections in babies can be tricky, but there are telltale signs. Common signs include ear tugging, increased irritability, and changes in sleep patterns. Fever is another common symptom, and it's important to monitor the baby's temperature closely. Recognizing these signs early on is crucial for prompt treatment. If you notice any of these symptoms, consult with your pediatrician for proper diagnosis and treatment. While ear tugging, fever, and irritability are obvious signs, there are also subtle cues. Changes in feeding habits, fluid drainage from the ear, and changes in balance can indicate an ear infection. Babies with ear infections may appear unsteady or have difficulty with coordination. In some cases, a runny nose or congestion can accompany an ear infection. Consider all symptoms when determining the cause. While most ear infections are treatable, persistent or recurrent infections might indicate underlying issues. These could include allergies, sinus problems, or anatomical abnormalities. Repeated ear infections can lead to complications such as hearing loss and speech delays. Your pediatrician might recommend further evaluation by an ENT specialist. Early detection and intervention are crucial in preventing long-term complications. If you suspect your baby has an ear infection, seek professional medical advice. Your pediatrician can diagnose the condition and recommend the most appropriate treatment plan. They will examine your baby's ears and inquire about symptoms and medical history. Treatment options may include pain relievers, antibiotics, or watchful waiting. Your pediatrician can also offer guidance on managing symptoms and preventing future infections. To understand why babies are more prone to ear infections, we need to look at the anatomy of their ears. The eustachian tube in infants is shorter and more horizontal, making it easier for fluids and germs to travel to the middle ear. Babies' immune systems are still developing, making them more susceptible to infections. Think of a baby's eustachian tube as a short slide, making it easier for germs to reach the middle ear. This combination of a short eustachian tube and a developing immune system makes babies more susceptible to ear infections. Understanding these factors is the first step in knowing how to prevent and manage them effectively. Common culprits of ear infections include bacterial and viral infections, allergies, and exposure to secondhand smoke. These infections can spread to the middle ear through the eustachian tube, leading to inflammation and fluid buildup. Allergies can cause inflammation in the nasal passages and eustachian tubes, making it easier for infections to develop. Secondhand smoke irritates the eustachian tubes, causing them to swell and become blocked. Feeding habits, particularly in bottle-fed babies, can also play a role in ear infections. Breastfeeding offers some protection as breast milk contains antibodies that help fight off infections. While all babies are susceptible to ear infections, some factors can increase their risk. Age, group childcare settings, and family history are significant risk factors. Babies between 6 months and 2 years old are most prone to ear infections. Group childcare settings expose babies to a wider range of germs. Family history of ear infections increases the likelihood of experiencing them. Certain medical conditions can also increase the risk of ear infections. Section 4. Shielding little ears. Effective prevention strategies. Preventing ear infections is always preferable to treating them. While it's impossible to completely eliminate the risk, several effective strategies can significantly reduce your baby's chances of developing these uncomfortable infections. One of the most crucial steps is maintaining good hygiene. Regular hand washing, especially before handling your baby, preparing their food, or after changing diapers, is paramount in preventing the spread of germs that can cause ear infections. Encourage everyone in your household to adopt this practice as well. Breastfeeding, as mentioned earlier, provides numerous benefits for babies, including protection against ear infections. Breast milk contains antibodies that strengthen the baby's immune system and help fight off infections, including those that affect the ears. If you're bottle feeding, ensure you hold your baby in an upright position during feeding to prevent milk from flowing back into the eustachian tubes. Avoid propping up the bottle as it can increase the risk of choking and ear infections. Exposure to secondhand smoke is detrimental to your baby's overall health, including their ear health. Make your home and car smoke-free zones to protect your baby from the harmful effects of secondhand smoke. Educate family members and caregivers about the importance of avoiding smoking around your baby. Vaccinations play a vital role in preventing ear infections. Ensure your baby is up to date with their vaccinations, including the pneumococcal conjugate vaccine, PCV13, and the influenza flu vaccine. These vaccines protect against common bacterial and viral infections that can lead to ear infections. Soothing tiny ears, effective management techniques. Dealing with a baby suffering from an ear infection can be distressing for both the little one and the parents. While seeking professional medical advice is crucial, there are several things you can do at home to help alleviate your baby's discomfort and support their healing process. One of the simplest yet effective methods is applying a warm compress to the affected ear. Dip a soft washcloth in warm water, wring out the excess water, and gently hold it against your baby's ear for 10 to 15 minutes. The warmth can help soothe pain and reduce inflammation. You can repeat this process several times a day as needed. Keeping your baby hydrated is essential, especially when they are battling an infection. Offer your baby plenty of fluids, such as breast milk, formula, or water, to help thin out any mucus and keep their system flushed. Adequate rest is crucial for a speedy recovery. Create a calm and comfortable environment for your baby to rest and sleep. Dim the lights, minimize noise, and maintain a cool temperature in their room to promote relaxation and sleep. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, only for babies over 6 months old, can be helpful in managing pain and fever associated with ear infections. Always consult with your pediatrician before giving any medication to your baby. including over-the-counter medications, to ensure proper dosage and suitability for your baby's age and weight. When to call the doctor. Recognizing the need for medical intervention. While home remedies can be effective in managing mild ear infections, it's essential to recognize when it's necessary to seek professional medical help. If your baby's symptoms don't improve or worsen despite home care, it's crucial to contact your pediatrician promptly. For infants under 6 months old, it's always best to err on the side of caution and consult your doctor at the first sign of an ear infection or any other illness. Babies this young have weaker immune systems and are more susceptible to complications, so early intervention is vital. A high fever that persists despite administering fever-reducing medication warrants immediate medical attention. A fever that suddenly spikes very high or is accompanied by other concerning symptoms, such as lethargy, stiff neck, rash, or difficulty breathing, could indicate a more serious condition requiring urgent medical care. If you notice any fluid drainage from your baby's ear, it's essential to contact your pediatrician right away. Fluid drainage, especially if it's bloody or pus-filled, could be a sign of a ruptured eardrum, which requires medical evaluation and treatment. Persistent crying or fussiness that doesn't subside with comforting or pain relief measures could indicate that your baby is in significant pain and needs further assessment by a medical professional. Section 3. Navigating medical treatments. Understanding your options. When you take your baby to the doctor for an ear infection, they will likely use an otoscope to examine their ears. This handheld instrument allows the doctor to visualize the eardrum and check for redness, swelling, fluid buildup, or other signs of infection. Based on the examination and your baby's symptoms, the doctor will recommend the most appropriate treatment plan. In some cases, the doctor may recommend a watch-and-wait approach, especially for mild ear infections in older babies. This involves closely monitoring the baby's symptoms and allowing their immune system to fight off the infection naturally. Pain relievers may be prescribed to manage discomfort during this period. If the doctor determines that the ear infection is bacterial, they will likely prescribe antibiotics. Antibiotics work by killing the bacteria causing the infection. It's crucial to follow the doctor's instructions carefully regarding dosage and duration of treatment. Even if your baby's symptoms improve before completing the full course of antibiotics, it's essential to finish the entire prescription to ensure the infection is fully eradicated and to prevent antibiotic resistance. In cases of recurrent ear infections or persistent fluid buildup in the middle ear that doesn't respond to other treatments, the doctor may recommend a surgical procedure called a myringotomy. This involves inserting a tiny tube into the eardrum to drain fluid and relieve pressure. The tubes usually fall out on their own after several months. Section 1. Recap of key points. Throughout this guide, we've explored the common childhood ailment of baby ear infections. We've learned that these infections, often caused by bacteria or viruses, occur when fluid builds up in the middle ear, leading to pain, discomfort, and sometimes more serious complications. We've also delved into the reasons why babies are particularly susceptible to these infections, highlighting the role of their developing immune systems and the anatomy of their eustachian tubes. Remember, those tiny eustachian tubes, shorter and more horizontal in babies than in adults, act like a shortcut for germs to reach the middle ear, making babies more vulnerable to infections. We've seen how ear infections can manifest in different ways, from the classic ear tugging and fever to more subtle signs like changes in feeding habits and balance. Recognizing these signs early on is crucial for prompt intervention and can prevent the infection from escalating or leading to complications. We've also discussed the importance of seeking professional medical advice if you suspect your baby might have an ear infection. Your pediatrician can accurately diagnose the condition, determine the underlying cause, and recommend the most appropriate treatment plan, whether it involves watchful waiting, antibiotics, or in some cases, surgical intervention. Knowledge is power, and understanding the ins and outs of baby ear infections equips parents with the tools they need to navigate this common childhood ailment confidently and effectively. Remember, every baby is unique, and their journey with ear infections will vary. By staying informed, proactive, and in tune with your baby's cues, you can help them through these uncomfortable episodes and ensure their healthy development. Section 2. Importance of parental awareness. As parents, we are our baby's primary caregivers and advocates. We know them best and are often the first to notice when something seems amiss. This innate parental awareness is invaluable when it comes to baby ear infections, as early detection and intervention can make a world of difference in preventing complications and ensuring a swift recovery. By familiarizing ourselves with the signs and symptoms, understanding the causes and risk factors, and knowing when to seek professional medical advice, we empower ourselves to be proactive partners in our baby's health journey. It's natural to feel overwhelmed or anxious when our little ones are unwell, but remember, knowledge is a powerful antidote to fear. Don't hesitate to reach out to your pediatrician, a trusted healthcare professional, or other experienced parents for guidance and support. Remember, you're not alone in this. Countless parents have navigated the ups and downs of baby ear infections, and their experiences can offer valuable insights and reassurance. By staying informed, vigilant, and proactive, we can help our babies weather these common childhood ailments and ensure their healthy development. Section 3. Empowering parents. The journey of parenthood is filled with incredible joys and inevitable challenges. Baby ear infections, while common and often easily treatable, can be one of those challenges that test our patience and resilience. However, by arming ourselves with knowledge, we empower ourselves to navigate these situations with greater confidence and peace of mind. Remember that you are your baby's best advocate. Trust your instincts. If you sense that something is not right, don't hesitate to seek professional medical advice. Your pediatrician is your partner in your baby's health journey and can provide the guidance and support you need. Building a strong support network is also essential. Connect with other parents, family members, or support groups to share experiences, exchange advice, and find comfort in knowing that you're not alone in facing these common parenting challenges. Remember that every baby is different and their journey with ear infections will be unique. What works for one baby may not work for another, and that's okay. Be patient, be persistent, and most importantly, be kind to yourself. You're doing a great job.